안녕하십니까?
Hello. We'll take a look at implant engines and 122 taper kit. I'm Dr. Ho-Chul Che, Neo Dental Clinic. First, implant engines. The most important thing when it comes to implant engine is the handpiece and the implant engine itself. First, the handpiece. The Cavo handpiece from Austin is the most convenient one that I have experienced among many handpieces that I have used. The implant handpiece uses 15 to 2000 RPM, consistent torque, irrigation, and direction for implant placement can be maintained with good grip. So it is a handpiece that brings very accurate implant placement. Implant engine has a digital display, and there are switches using the buttons. RPM or torque can be controlled, and they can be controlled with the foot pedal. Components of implant engine: main engine unit, a foot pedal, and the tubing to connect the handpiece, saline holder. So these are all for placing implants. Implant engine modes. The recommended programs or modes are the drilling program and placement program. And there are 8 modes that can be set. And here there are 6 modes listed here. Marking is carried out with a mode of guide drill with a torque of 20 and usually the speed of 1200 RPM. 2.2 or 2.7 pilot drill is used for this with torque of 20 with the RPM of 800. Next, template drilling, torque of 20 and 1200 RPM. Implant placement, 40 torque and much lower RPM of 25. When removing an implant, stronger torque of 50 and RPM is set at 50 in the reverse mode. Implant drilling sequence. 122 taper kit. There are 3 tool types: drilling tool, implant placement tool, and superstructure assembly or connection tool. First, drilling tool. A variety of drills are available. The first one is the lens drill and the side cut drill with the side blade, 2.2 twist drill, 2.7 twist drill. There's a stopper here but not here. 122 taper kit drill, 3.5 to 5.0 diameter drills are available. Drill extension and parallel pin is used to look at the parallelism. Depth gauge is to check the drilling depth. If you look at one by one in more detail, first, lens drill is used to mark the implant placement position. Usually the recommended RPM is 12 to 1500 RPM, up to 13 millimeters in length. As you can see, the placement site is marked so that a twist drill can go in there without moving side to side. Next, side cut drill. As the name indicates, the side is used to expand the marked point. Without using a lens drill, a side cut drill is used for marking. It doesn't really matter. After marking on the buccal or lingual side, when direction is not correct, using a side cutting drill, the placement direction can be modified. Twist drill, 2.2 millimeters and 2.7 millimeters. First, 2.2. The lens drill marks the point of placement, and the recommended RPM is 800 to 1200. So it is drilled in the direction of placement. Next is the 2.7 millimeter long twist drill. There's no stopper. So that is the advantage. So it doesn't interfere with the adjacent teeth, and direction can be changed freely, and it is easier to use. Drilling tools, 1 to 2 taper drills, 3.5 to 5.5 millimeter in diameters. So various taper drills are shown here. So you can see 1 millimeter space below the stopper. TS-type submerged implant can be placed. In principle, an implant should be placed 1 millimeter below the alveolar bone, so there's 1 millimeter space provided. The Y-dim part ranges from 0.7 millimeter to 1 millimeter. So if you want to place a 10 millimeter implant, 12 millimeter is the drilling depth. Therefore, we need to be very careful, mindful of inferior alveolar nerve. In the drilling tools, the drills may not be able to go into bone in the maxillary anterior region because of the interference from adjacent teeth. The irrigation part of the handpiece can be cut. That's why a drill extension is needed. The extension can be made up to 16.9 millimeters. Depth gauge. A hole is drilled and we don't know how deep the hole may be, so we can use the depth gauge to identify the depth of the drilled hole, and it is made easier. On the other hand, we have an open wrench. After placement, when primary stability is not sufficient, if you just rotate and remove the cover screw, an implant can come out together. So you need to connect the open wrench to the mount area. Without making the implant mobile, primary stability can be increased. Implant placement tools, mount driver, no mount driver, implant driver, mount extension, torque wrench, and a removal tool. First, mount driver. A mount driver is connected to the mount area of an implant, and a handpiece is connected. There is a short version and long version. In general, the long one is used for the anterior region of maxilla or mandible, and the short one in the posterior region. Implant driver. After placing an implant, after removing the mount, when implant is in bone, for detailed adjustment, implant driver is used. So there is a TS type and SS type. Mini implant driver. When we place the 3.5 millimeter diameter implant, this is used. For 4.0 or bigger diameter implants, we use regular implant drivers. Mount extension. It is used to extend. Torque extension. After removing the mount, after placing an implant in bone, this torque is used to place deeper or to pull it up a little bit for detailed adjustment. Removal tool is used quite often. The instrument is used to separate the mount. When the mount is jammed after placing a pre-mounted implant, we encounter this kind of a case quite often. In this case, we can use the removal tool and rotate it in the clockwise direction to easily separate the mount from the implant. So this instrument is quite useful in such a case. Lastly, superstructure assembly tool. A hand driver is routinely used and a torque driver is used to remove prosthesis. There is short type and long type. After placing an implant, the mount screw is removed, and after the placement, cover screw is assembled and sutured, and after a certain period of time in the second surgery, a healing abutment is connected and superstructure is connected, and impression coping can be used using the hand driver to connect the impression coping. Torque driver, short one and long one. As I said before, an implant can be connected to the superstructure using a torque driver used together with a torque wrench. So I have been talking about 1 to 2 taper kit to place implants. If you want details, please join the offline master course. Thank you for your attention.